Good morning and welcome to New York Viewpoint. I'm Ken Rosato. Today we bring you a new book that is geared toward those over 50 who are looking to work. We'll also have with us Daniel's Music Foundation. That's a group that works wonders for music lovers who happen to have a disability. But first, we bring you the AIDS Service Center of New York City, which has for the last 20 years been helping individuals and families to maintain the best possible quality of life. Joining us in the studio from the AIDS Service Center of New York City are Sharen Duke, their CEO and Executive Director, Brenda Starks-Ross, their Chief Operating Officer, and Kingstan Wilson, a peer educator. Welcome to all three of you.
Thank you.
20 years. Has it flown by?
Well, I really have grown up with the organization, and I'm very proud of the positive changes that we've helped people make in their lives, the community centers that we've opened, the thousands of people that we've helped, and the change that we've made in New York City by promoting connection to medical care, stability, and community.
So that is the principal mission. If somebody walks into the center, what are they walking in for?
Well, AIDS Service Center clients really come from all different cultures and lifestyles, histories of addiction, incarceration, prostitution, domestic violence. But when they walk through our doors, they're met with respect, help, and hope. And our programs, from HIV testing to connection to medical care, peer education, and safe practice counseling, promote wellness, stability, and connection to community. And we're very proud that each year our peer educators reach over 14,000 New Yorkers with messages about the importance of HIV testing, knowing your status, and getting connected to care. Each year we conduct 3,000 HIV tests, distribute 40,000 condoms, and save over $500,000 in resources, because the services provided by our peer educators are equivalent to 15 full-time employees at a net savings of $500,000. So the peers are not only incredibly inspiring and authentic messengers of prevention, but they also are cost-effective and wonderful partners.
So you know nothing about this organization is what you're saying. Yeah. And you have no zeal or support for her. Okay, fine, we won't talk to her anymore. It's wonderful that you have such a passion and you work so very hard in this organization. Let me ask you, Brenda, tell us about the demographics, the typical people who come in to you.
Sure. At the AIDS Service Center, 90% of our clients are people of color, about 50% African American, 40% Latino, and then we serve others. 70% of our population are people who are active substance users or recovering addicts. About 35% are women. It's hard to get women out of the house, so at AIDS Service Center we go into the community to service them and where they live.
How do you do that? What do you literally knock door to door? How do you do that?
How do we go into? Yeah. We actually partner with schools, with public housing. We go into places where the women frequent. And one of the programs that we, and we go into churches as well. But what we do is, like with the PTA, when we work with that program, while the children are in class, we gather with the women and do education with them, talk about safe sex practices, teach them about the importance of protecting themselves and ways to use condoms safely.
And now, Kingstan, you are a peer educator. What brought you to that? How'd you get involved in that?
What brought me to that is the fact of the positive change that the center made in my life. I came to the agency paralyzed with fear and stigma, being a HIV positive man of color. I wasn't so open to that, and no one knew when I first came to the center or the agency. I just wanted to do something to give back. But in the midst of that, and the warmth and the respect and the love that they have there at the agency, it allowed me to be more comfortable with who I am today, and allowed me to be able to tell my story and to tell people that I am a proud HIV positive man, and that I got my second chance in life to make a difference and to be an upstanding citizen and to stand up and be counted for.
Knowing where we are today in terms of drug research and the AIDS and HIV cocktails that we have today versus 20 years ago, you must, if one has to have HIV, this is the, it sounds so heartless to say this is the time to have it, but if you had to have it, with the advances now, I mean, so many more lives are saved, but at the same time, do you find it difficult to get through the heads of younger people how important safe sex practices still are? Because even though these cocktails can prolong your life, or in many cases save your life, not everybody is successful with them, correct?
Well, there still is no cure. And
Right.
that's really the difference. People are living longer, which is a wonderful thing, and the HIV population, in fact, is aging. But so the perception is that, oh, it's a chronic illness, and therefore it's no longer a crisis. But absent a cure and absent a vaccine, it has to remain a crisis, because otherwise people's lives will be cut short by this disease. There continues to be stigma around HIV. There continues to be new infections each year. And the medication regimens, while there have been incredible advances, they're also complex, and it's hard to, if you've ever been on antibiotics, you know that it's hard to take yours twice a day, 10 days, and this is the rest of your life. So programs like ours really are very important in partnering with medical facilities and helping people adhere to their medications and also connect to medical care, because as folks age with HIV, they also have other chronic conditions.
The normal chronic conditions that anyone develops.
Diabetes,
diabetes, et cetera.
Yes.
So now, I was reading a statistic that's showing that a lot of younger people today are going back to unsafe sex practices. Why? What is going on in society today that they're not getting the message? You know, I mean, 25 years ago, you couldn't find condoms on every street corner. Now they're practically wherever you could buy candy, you can buy a condom. Why are kids today going back to this concept of unsafe sex? And so, you know, we're starting to see little spikes again in HIV infection when it doesn't have to be.
I think a part of it is that they don't have the history that some of us have, who were there in the very beginning when people were dying every day. We went to funerals weekly, literally weekly. We sat with people when they were taking their last breath. So they don't have that history.
Right.
You know, and some of us have become complacent, but they don't have that history. And some of them feel, like you said, well, I can take a pill and I'm going to be all right. It's okay if I'm infected, because I'm going to take a pill and I'm going to be all right. You know, they see the commercials where you can climb a mountain and, you know, you can live forever. So there's the need for more education, and that's what we're doing at the AIDS Service Center. And we're going, and Kingston can speak more to that, but we're going into venues like to clubs, to chat rooms. We're going into churches where people think that people don't get infected, but they do. So we're trying to go into venues that people don't normally go into to send this message to say, hey, guess what? You can get infected.
Yeah, it can. And unfortunately, we got about 10 seconds left. So just to wrap it up, what are your hopes for the future?
Our hopes for the future are that people learn about AIDS Service Center, donate, contribute your time, your talent, become a part of our programs, visit us, and see positive change happen. We're really, really proud, and on a personal note, I'm the agency's first director. I've grown up with the organization over these past 20 years. It was my first baby. I now have 3 of my own, Alina, Sammy, and Rashi, and I promised I would say their names out loud.
There you go, on TV. All right, I want to thank all 3 of you for being here, and all the best with the organization and for all the hard work.
Thank you so much. Thank you so much.
We're coming right back with some valuable information if you're looking for work, especially if you are over 50. Please stay with us.